This video is for mental health therapists and clinicians who treat social anxiety. When a client says, "I don't care," or "I don't want to," it's often labeled as resistance. In social anxiety, this is very often protection in the pre-contemplation stage, not refusal. Misreading this slows treatment, increases shame, and damages rapport. In pre-contemplation, social anxiety often sounds like, "I'm fine," "I'd rather stay in," or "I just don't feel like going," and the ultimate one, "I don't want to." Clinicians often hear these phrases as preference, low motivation, and often resistance. So treatment speeds up, goals get introduced, exposure gets suggested too early, and the client pulls back. Social anxiety pre-contemplation is not a passive experience. It's active threat management. The nervous system has already decided how this will end: rejection, embarrassment, failure. Under that lens, avoidance feels rational and it makes a lot of sense. Yet this rarely leaves their mind completely, often hanging out as the inner critic. Through the shame lens, this isn't seen as denial. It's safety mode. Shame begins to assume failure before action even begins. Why try? What's the point? Nothing will change anyway. So avoidance reduces anxiety immediately. That relief is alluring. The body learns fast. So avoidance becomes the safest option available. Not the healthiest, the safest. This is called emotion-focused coping. And this is not the stage for persuasion or motivational interviewing we would employ for problem-focused coping avoidance. It's not the stage for exposure planning either, which we might do if values and skills were aligned. It's also not the stage for motivational speeches because, again, this isn't logical, even though it feels logical. Logic for emotional experiences often increases shame through the misunderstanding. So, your job in pre-contemplation is awareness, not action. To gently name the protective story without shaming the effort of protection. And that's where movement actually begins. In the next videos, I'll walk through how each stage of change shows up in social anxiety and how shame quietly drives movement between stages. If you want the full framework for understanding the shame underneath social anxiety, that's what the free shame lens map and the CEU underneath social anxiety were created for. I'm Dr. Matt Bedell, a licensed professional counselor supervisor and licensed chemical dependency counselor. And this is based on my doctoral research and years of specializing in social anxiety. I'm really glad you're here. Let's keep going.